Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business. And very delighted to have my good friend Dr. Geetinder Goyal. He's a regular contributor on The Price of Business. Brings some great free market healthcare ideas to the program. And he and I are partnering together to try to create a paradigm shift, an attitudinal change when it comes to healthcare in our country. He's founder of Our Way Health, the website, OurWayHealth.com. How are you doing, Geetinder?
I am very well, Kevin. Glad to have you back. I see that you have recovered from your bout of bronchitis.
The battle continues, but I am doing much, much better. No question about it. Talk a little bit about the idea behind Our Way Health.
Yeah, I want to share some data with our audience. We as a country spent $3 trillion on healthcare last year. This is 2013 data, actually, so maybe 2 years ago. $3 trillion is 18% of our GDP. And over the next 10 years, it's going to be 23% of our GDP, our expenditure on health. So that is almost one-fourth of our total GDP that we are spending on health care.
It's unbelievable.
$9,000 per person per year is what we spend on health care system.
It's unbelievable, and some of that, does have to do with demographics. Well, over one-third of the population are baby boomers or older. But most of it has to do with the fact that we have sick care rather than health care, as you have said so often on the show. Talk about that.
Exactly. And we definitely have a lot of our aging population. That's where the healthcare dollar is going on. And as we go further, more and more people are going to join that age group. So there is no, cost savings in sight. And that's why the prediction is that more and more of our health, our total dollars we're going to be spending on taking care of our elderly. But really, it is about changing the way how we spend our dollars, right? And it should be more on healthcare and not sick care. And that really comes down to quality primary care access for people. In spite of spending this much money, our system continues to be plagued by lack of quality access, really shoddy customer service, poor accountability. Affordable Care Act came and went by and did nothing to solve these problems. People are arguing that it may even make things worse. So we really have to reimagine some of the fundamental problems with our healthcare.
Yeah, no question about it. Yeah, I would think most would argue that that's exactly the case. Our situation has only gotten worse rather than better by the situation. Talk a little bit to me about the situation with with how your practice is going to do things differently and addresses those systemic issues.
Yeah. First, what we have done is we have created a bundle of services in the primary care space. Insurance is not good if you cannot see your doctor on a timely manner and in a good quality manner. If you have to wait 7 days, 2 weeks for an appointment, you're probably going to be more sick by the time you see your doctor. So it's not timely care, right? And then if you go and have to sit in a waiting room for 2 hours with a room full of sick people and see your doctor for 7 minutes, I want to ask people, how well is that insurance serving you? Is it really worth the premium amount that you're paying monthly? I don't think it is. So what we have done at Our Way Health is we have bundled all the primary care services, and we have put them at a cost of a low fixed monthly payment. So you get excellent primary care, excellent service, excellent access at a low monthly fixed dollar amount. What that does is, number one, it gives you quality care, but now your insurance company is not seeing as many claims as it used to be. Mm-hmm. You have more control over your premiums. Mm-hmm. So you get quality care, buy cheaper insurance by combining our model, by getting good quality primary care. And let's be honest, 80% of your health care needs a primary care doctor's office can handle.
Yeah.
So you're really getting a lot of care at a very low monthly fixed cost.
Yeah. Talk a little bit, by the way, I do want to mention Dr. Goyal is going to be on my television program. He's going to be taping with that. We're taping the first episode of the Price of Business TV show over 38 million homes coast to coast around the country. It's 11:30 a.m. Sunday, January 3rd, Eastern Time, and 8:30 Pacific Time, and all those time zones in between. So we're excited about that, and look forward to you being able to share that message to an even larger audience.
Yeah. And then, it is really about our audience getting smarter. And it's not that we are not smart, but I think we have stopped thinking about our healthcare. Healthcare has become a pain point that we'd rather not think about. We'd rather not think about, how much we are paying for it. How much does it actually cost?
Yeah, no question about it. No doubt about it. So talk a little bit to me about, how, what kind of trend is going on to address these issues. I think Americans are beginning to wise up that there are some systemic issues, and the so-called solutions to those issues, which are government and insurance companies, are really the biggest problems.
They are, because what they do is the government and insurance industries, they fix prices for healthcare, right? That's not happens in any other industry, right? If you fix the price of cell phones for every cell phone manufacturer, what is the incentive of, let's say Apple to improve the quality? Apple sells a phone at the prices they think are the best, and they invest in the quality of the product. That's what needs to happen in healthcare. If I have a service that I'm investing in, I am making sure that I offer excellent quality customer service. I invest in bringing new useful technology. I should be able to price my own product the way I want to. That's what creates healthy competition, healthy marketplace for, innovation and development to flourish. And the good thing, like you mentioned, is Kevin, that there are signs that the market is embracing that model. The patients are slowly realizing that we need to ask questions about, what you're getting. Providers are moving towards that market. They are frustrated with the insurance and government regulations and are now setting their own prices, selling directly to the consumers, and I think that's a very good thing for our healthcare system.
No question about it. I think it's exciting, and people really do need to get a clue. I'm glad they're getting a clue. They need to really work on coming up with with solutions that work, and those are in the free market. And you described very aptly the free market model there.
Mm-hmm. Yes, absolutely. And I think this movement is going to, get even better. The influx of high deductible health plans into our health insurance system will promote free market model even more, because more and more of costs are being shifted towards our consumers. Insurance kind of shields our consumers. But now that more and more out-of-pocket costs are apparent, I think our consumers are going to get smarter, and that's what's going to help the growth of free market.
I think you're right. We got about a minute left. Final thoughts before I let you go?
My thoughts are start with primary care. Primary care doctors are your quarterback. When given time, they can really be the quarterbacks as well as your first line of defense for any health-related issues. So like you would do for your wealth management, you need a good financier proactively managing your wealth. Similarly, you need a good primary care doctor proactively managing your health. So invest in finding a good primary care doctor who's working for you and has your interest at heart, and not a insurance company or a government agency.
Dr. Geetinder Goyal, he's a regular contributor on The Price of Business, and you can tell why. And we love your guests, but we also love it when we can occasionally have a chat with you. And looking forward, by the way, getting you on the the premiere episode of the Price of Business TV show, January 3rd, on the Biz TV network. I'm Kevin Price. More for you after this on the Price of Business.